Steph. How are you? Nice to see you.
Hi, Tina. Nice to see you too. Happy New Year.
Happy New Year. Thanks for joining Tina Talk. I'm really excited to have you here today. And I thought I'd do a quick introduction and we'll jump into some questions.
Sounds good.
So for everyone's reference, Stephanie Newkirchen is a principal with our Deloitte Consulting LLP group, and she leads our digital care offering for Core Industry Solutions. Stephanie has more than 20 years of experience leading health IT and implementing large enterprise clinical and revenue cycle systems. Stephanie has significant experience leading complex multi-facility clinical and revenue cycle implementation projects, in-depth knowledge of electronic health record applications. You're highly skilled in clinical and revenue cycle strategy, clinician and end user adoption, and value realization. Gosh, that's a long list. I love it. I know you've led a lot of engagements across all areas of business and IT strategy, including tech strategy. And, you know, tech is so hot right now, whether it's IT due diligence, merger integration, planning, governance. There's so many things going on these days, right? So as about digital health, Stephanie, why is it so important to our industry and why now?
Yeah, great question, Tina. So I think a little bit about my background. You mentioned electronic health records, and over the last decade, I think we've really been laying the piping and the infrastructure to finally get all the core platforms in place in the healthcare industry. So we've really just started the digitization journey, and now that we've sort of laid these super highways, I mean, now the exciting part is that we really can start to get at the data and, you know, really bring a more consumer centric view to healthcare. And I think that we can start in healthcare to really look to, you know, what's happened in a lot of other industries. If we look at retail, if we look at the transportation business, if we look at consumerism, the consumer has really been able to be part of the digital experience. And in healthcare, we really haven't been able to do that yet, and we're just on the cusp of it. And we're really going to start to be able to bring digital health solutions to patients.
Well, and that's an interesting topic, just this whole changing perspective of patients and consumers. You know, with the COVID pandemic, virtual health was just, you know, it was really introduced fast and furiously. So where do you see this going? Is it here to stay? Will it continue to evolve? And really, how does that really, you know, flow into this whole tech discussion?
Yeah, so I mean, it was amazing, right? So if you think about it, with most healthcare organizations, they were maybe doing 50 to 100 virtual visits a week, if you pick an average size health system. And then suddenly the pandemic hit and organizations went to doing 4,000 video visits in a week. And they just adopted that technology like fast and furious. And they were able to make it work. And so I think virtual visits, it was a great starting point, and it's really catapulted us. And I guess it's been a positive thing about the pandemic to really start virtual health. And you know, legislation changed, which made reimbursement possible, which also helped with the adoption of the technologies. But really, I think we're just at the cusp, and you know, virtual visits and is just the beginning. And now I think we can start to explore, you know, taking care of like chronic patients in their homes and managing that virtually. I think remote monitoring, hospital at home, and you know, caring for patients outside the walls. And I really think we're going to see, you know, over the next year to few years, we're really going to see the virtual health agenda explode and just continue to advance, and how we're taking care of patients outside the walls of either the ambulatory setting or the hospital environment. And I think that our providers and our health plan clients really need to start to, you know, think about, you know, what that virtual health journey like looks like for them, and where they want to be at the end of this calendar year and the end of next year, with providing just, you know, digital and different experiences for patients, and allowing patients to really be able to, you know, to receive care and visit with their provider in a way that they want to, which is very different from how it's been in the past.
Yeah, old school to new school is really important. And if I'm a leader, so I'm a CEO, a CIO of a health system, what should I be thinking about to stay ahead of the game and combat these challenges? Are there risks to think about? What's your best advice?
Yeah, well, one thing I would say, and I do want to talk a little bit about sort of the broader digital health agenda, but one thing I would say about virtual health is our clients really need to be thinking about like privacy and security, and really protecting the data, the consumer end of the patient. And so that's going to really get the patient more comfortable, and allow them to want to engage in these different types of technologies if they feel like their health information is staying safe and protected. So I would absolutely put that out there. And then more broadly, thinking about digital health, I think our clients need to really start to think about how they're going to use predictive analytics and machine learning. And there's a real shift happening now, in the industry to be taking care of populations and having it be less about the management of like diseases, but actually keeping patients healthy, keeping them well. And so
right, that whole shift, right? The value-based care and chronic management of conditions.
Yeah, and so now that we have all this data available in electronic health records, it really starts to open things up where our clients can really start to look at the data. They can start to predict what patients are at risk for readmissions. How do you stop that by keeping them in their homes and caring for them? And we're just really at the cusp of starting to learn about that and really put it into practice. And then I know we all talk a lot about interoperability, and that's on every healthcare leader's mind right now. And really, that's what's going to also catapult the industry, is just really being able to share the data and information, across walls. And again, it's important that we keep data safe, and that patients feel that their data is protected. But interoperability is really going to start to advance healthcare as well.
Yeah, no, it's super exciting times, and you're right in the middle of it all. So thanks for all you do. I know that you're really helpful to our clients and available if there's any follow-up questions. So thanks, and have a great day.
Thanks, Tina.